Hello, and welcome to Discover Brightside, a video channel that's multimedia to help you discover new things. And today we're doing health and wellness. This is actually our fifth year that we've been doing health and wellness, and we've had 5 years with Dr. Deitrick. So it's been a real pleasure knowing her, and she has been with us from day one. So I don't want to take a lot of time to share with you some great things that we're doing, and I'll save my speech for the end. So over to you, Dr. Deitrick. She is an author of 5 books, and she is here and she's board certified in family medicine, and she's here to give you some good news on how you could be taking better care of yourself. So over to you.
Thank you very much, and hello, everybody. Good evening. Thanks for inviting me back. And I'm gonna get started on my presentation because I know we're stewards of the time, right? Can y'all see me? Or no, I just see my slides, but can y'all see me?
We can see you. Let me put you in the
Okay,
spotlight.
wonderful. Okay, well, I'm going to be talking today about the pillars of health, since this is our health and wellness session. Okay, so I'm going to discuss the 6 pillars of health with y'all briefly. And so that if you all can start, if you have not already or currently, just kind of start thinking about how you're going to implement and improve yourself and your well-being. It doesn't have to be a whole lot of major things, but just smaller things. And it doesn't have to be very difficult. And I just wanted to say that, in my opinion, for you to enjoy your dreams, your thrive in your business, be successful, have optimal relationships and whatnot, and just fully enjoy your life, it's best to have it done healthily, to be healthy. Okay, because I mean, what's worse is that you're always in pain, you're just not feeling good, and then you still have to perform. And so that's why I'm going to talk about the 6 pillars of health, and we'll get right into it. Nutrition, number one. And this one can actually be hard to digest. No pun intended. Think about this. Every bite that you eat or every fluid that you consume has a metabolic and nutritional consequence. Whatever we eat, our body tries to use. So how can you feel good if you're not feeding it the best foods? Okay, you can say, "Oh, I just feel horrible" and whatnot, but what are you starting off with as far as your nutrition? So it's recommended to get your gut together, get your liver healthy as possible so it can work and do one of its many, many functions. Hydration. All of our bodily processes occur in water. So hydration is key to our health. So basically just give your body, your organs, your brain something to work with. It wants to do right, but you have to treat it right. So I recommend, if you're not doing the best that you know that you can do, just apologize to yourself right now if you're not treating it right, and just pledge that you're going to do better from this moment forward. And again, it doesn't have to be major drastic changes, but just start incorporating little changes that will add up. The second pillar of health is movement. Now, movement, exercise, shake those bones, move those muscles, stretching. As we get older, things start to slow down, but you don't have to help it slow down by not moving what you have. And it is recommended, the guidelines, to move 30 minutes a day. But if you're not doing that, I wouldn't sweat it, no pun intended. Start off 5 minutes, 10 minutes. Do something more than you normally do during your baseline. So when I'm talking to people, they may be like, "Well, doc, I'm on my feet all day." And I understand that, and that's great. However, your body is used to that set point. So you need to kind of trick it a little bit, do a little bit something different or a little bit longer that you're normally used to, so that you can reap the benefits. Start resistance training, building those muscles, strengthening your core to help improve your balance. The third pillar of health is sleep. And it is recommended, from the National Sleep Foundation, their guidelines recommend getting like 7 to 9 hours of sleep. And I totally know that that is easier said than done. You know, just try and get it as close to that as you can. But there's some poor sleep contributors, such as caffeine, night pollution, meaning like you have those bright lights on in your bedroom when you're trying to go to sleep. If it's too warm, they recommend it being a little bit cooler for you to get a good night's sleep. Stress can actually make you not be able to sleep a lot, and I'll talk a little bit more about that later. The fourth pillar of health is relationships, our social connections. So we as humans were designed to be around other people. Even if you're an introvert, of course you can have the time where you're alone, but we're meant to be, connected with each other. So work on building strong, truthful, happy relationships because we do need each other. And those relationships that are not serving us, those that are more toxic, you need to really evaluate what's the benefit is it having with you. So try and incorporate and cultivate healthier relationships. The fifth pillar is to avoid toxins and risky substances. So we kind of already know like the obvious, the tobacco smoke, that doesn't have any benefit. Of course, the illegal drugs, alcohol is over time is not the best, especially for your liver. But one thing that is kind of brought to the attention is processed meats. Processed meats are considered to be carcinogenic, group 1 by the World Health Organization. There's actually just a couple of statistics. There's actually estimated 34,000 cancer deaths per year worldwide linked to diets that are high in processed meats. So like bacon, sausages, deli meats, those kind of cured meats can actually increase your risk of developing cancer. And I believe it's more so colon cancer because they're adding nitrates and nitrites, which can form those cancer-causing chemicals. So I put this in the classification of toxins and risky substances. Then the sixth pillar of health is stress management. And this is my thing. I talk about how to better manage your stressors and incorporate relaxation into your lives to better help you with your stress management. And let me tell you, unmanaged stress is no joke. And it actually permeates every aspect of your life. And bringing it on to the other 5 pillars, nutrition. You may be like, oh, I'm not going to eat this today, or I'm going to eat this today, or you eat too much, or you just don't eat the right food. So that's nutrition. Movement. And I'll exercise later. Or I have too much to do. I'm too busy. Oh, I'm too achy. I'm not going to do it. I'll do it tomorrow. The sleep. You just can't sleep because your mind is racing all the time. It's stressed out too much, thinking about a whole bunch of different things. Your relationships, actually, you get attitude, you give attitude, right? Your relationships suffer. People get on your nerves. You may not be in the mood. You're just not who you know that you want to be or should be. And it affects your interactions with other people, of course, as well as yourself. And then the toxins, resorting to poor coping mechanisms, drinking too much to drown out what's causing you or plaguing you, that stress. Same with smoking. Now, getting more into what I actually do, thinking about some acute stressors. Now, let me tell you, we as humans are designed to handle acute stress in the acute moment. And we need to go back to the relaxation period after it's done. So there are some stressors that we find we may encounter on a day-to-day. Accidents, traffic, injury, arguments, giving a speech, trying to meet a deadline for work or whatnot. If there's a storm coming, we might be like, oh, we're getting kind of nervous and stressed about that. Or actually traveling, that can be very stressful for some people. But in the acute, it's not that bad because it'll help us flee danger. It'll increase your alertness. It'll give you more energy to get things done in the short term. And just really briefly, not going over the acute stress response, your body knows what to do. It's already wired to kick in when you are perceiving an acute stress. For example, your pupils will dilate, your respirations will increase, your heart rate will increase. blood flow will actually decrease to your digestive and reproductive organs because you're not sitting there wondering about, oh, if I'm going to eat or if I'm going to procreate. You're trying to get out of there and flee danger. Your liver is going to make more glucose that will supply those muscles with energy to get out of there. So there's a whole host of things that go on in your body when you have that acute response. But like I said, once that immediate stressor is done, the body's calm state should be reacted. And honestly, that's where we get into problems when we deal with our chronic stressors, such as the ones that are listed here. You're constantly full throttle. Long-term stress can actually lead to many serious health issues. Okay. Chronic stresses are something you deal with more of a long-term basis. It's usually daily. It can be real or created in your mind. And these are just some of the chronic stresses that I'm listing. The next slide, I'm really going to share with you all a staggering statistic that I received from stress.org. And I see this as a family physician. 75 to 90% of all visits to the primary care are related to stress. And to me, that is definitely an alarming statistic. And basically, if there's a way that you are not able to manage your chronic stressors, this is your life, right? It's really a hot mess when you can't just get it together and get your chronic stressors under better control or better manage your chronic stressors. At work, briefly at work, your productivity decreases, your procrastination is increased, you call in more often, more mistakes can be made, there's injury and there's isolation. People don't want to be around you or you kind of isolate from other people. At home, your relationships are strained, poor communication, less interaction, home upkeep suffers, all that. And then look at your health. There's a whole host of health issues that are prominent when you have that chronic unmanaged stress. But as far as stress management, you can help this in one of two ways, or two of two ways: reducing your exposure to a stressor and or practicing techniques that help you to better manage your stress and those consequences of having chronic unmanaged stress. And in the interest of time, I'm only going to talk about three of them. They're high on the list, but please know that there's a whole lot more things that you can do. We'll start off by breathing, specifically deep breathing. It actually sends a signal to your body that I am safe, I am calm, I can rest, I can digest. But honestly, a lot of people aren't aware of how they're breathing, especially in those stressful times, which is understandable. So if we can get a hold of our breathing and practice it beforehand, this will be more beneficial to eliciting that calm state when we need to be. There's this upper chest breathing. A lot of people do when they're stressed is thoracic breathing, in which you're breathing from your chest, versus the belly breathing and diaphragmatic breathing, in which you see this diagram, you're kind of expanding the whole lower rib cage. And what this does is it actually helps to activate that parasympathetic nervous system, that vagus nerve, to help you kind of calm things down. I don't think we're going to have time to practice some breathing because I know my time is about up. But box breathing is an effective method that can be used kind of anywhere before a stressful event, during, or even after. And it doesn't require you to be in a calm environment to be effective. And they actually call this Navy SEAL breathing because Navy SEALs implement this in times of extreme stressful events, which they are a part of. Decluttering. Decluttering is huge. Okay. For me personally, when I see everything is all on my desk at work, my mind just can't think. I feel anxious. And so make it a priority, even if you pick like one day a month to tidy up a specific area or retidy up a specific area in your workplace. Make it zen. Make it pleasant for you for when you're in that area. In your home, make your home your haven. Toxic relationships. So I put this one in there because sometimes you might just have to cut people loose who are not benefiting you or who are not adding to you. Okay, so decluttering your relationships, especially not the beneficial or the toxic ones. And then finally, gratitude. There's actually research that shows that when you're consciously practicing gratitude, it can reduce the feelings of stress and anxiety. And studies have found that even a single act of thoughtful gratitude produces an immediate 10% increase in your happiness and a 35% reduction in depression symptoms. And these effects actually go away after 3 to 6 months if you don't keep it up. So that's why it's something to practice over and over again. I know I'm sorry I'm kind of speeding up, but I am a best-selling author. I know it was mentioned I'm a five-time author, but those other two are anthologies. These three I've actually done myself. One is a book on workplace stress. Another one is a coloring book that has inspirational sayings that can help calm your mind. And then also a reflective journal, a reflective gratitude journal. So I hope you will consider those. You can go to drdeitrickg.com to look at those. And before I leave, I want to make sure that you all take advantage of a free ebook that I gave you. It's called 50 Ways to Treat Yourself Well. You can scan the QR code or I can put that in the comments. And then finally, you can book me to speak. I go over mostly all in Texas, but of course, I'm willing to travel. I speak at conferences. I do personal development at work, lunch and learns, virtual talks, and actually many relaxation events. So contact me if you are interested. And I thank you for your time. That was a quick one. Thank you so much.
Thank you, thank you, thank you. That was lovely.
Yes, thank you.
Everybody, give her a big round of applause. That was awesome. That's
Thank
awesome.
you.
Um, so Beverly, I don't see Beverly. Okay. All right. So why don't we just go in the order of what we can see as a screen? So Mary Beth, if you want to introduce yourself and tell us what you do, and we'll go around and then we'll do a panel. Now, if you have to leave, I understand, but those of you who can stay, we'd like to record a nice panel discussion, and I put the questions in the chat. So over to you.
Hi, I'm Mary Beth O'Connor, and I'm the author of From Junkie to Judge, One Woman's Triumph Over Trauma and Addiction. And in there, I tell my personal story of how child abuse and sexual abuse led me to use drugs at 12, shoot meth by 17. I didn't get sober until I was 32, but in sobriety, I not only built a happy and productive life, but I, at 20 years sober, became a federal administrative law judge. And I try to use my story to reduce stigma, to give people hope and encouragement that there's a path out. But I also do a lot of speaking and educating about, what is addiction, which today we call substance use disorder. What are the treatment options? What are the peer support groups? How do other mental health conditions interplay with substance use disorder? How does trauma interplay with addiction? But also to, talk to friends and families. What can they do to encourage their loved one to find a path out? I have a number of workshops I present about peer support options and about those educational topics. I do a lot of writing. I do keynotes. I'm available for any, basically I'm a retired judge, although my husband says I need to look retirement up because I don't understand what it means. But my goal today is to be of use, to be of service, to help inform and to really help reduce stigma and increase hope around substance use disorders.
That's wonderful. And you've really her story is quite incredible. So thank you for sharing everything with us. So over to you, Brittany. Tell us about what you do, and we're so happy to have you all.
Well, this has been very humbling. Right before this, I ate chocolate and I've not gotten up from my seat all day long. So I'll tell you what I'm not doing well. My name is Brittany O'Brien. I'm a licensed professional counselor and a registered play therapist about an hour north of Atlanta. And so the bulk of my caseload is working with children ages 3 to 10 that have been sexually abused. And then I also treat adults that have PTSD as well, primarily stemming from childhood. And so kind of the mindset that we can't target stress until we get our heads in the right place. And there has to be a place of readiness for that. And so much of what you said, Dr. Gorman, just hearing it is it has to happen, right? We have to have all of these pieces in place. So I enjoyed getting to hear that. And I'm looking forward to getting to hear from everyone else as well.
Wonderful. Jonathan?
Hi, yeah, my name is Jonathan Snowiss, and I'm over in the left coast in Southern California. So it's not even dinner time for me. My specialty is a thing called Qigong. I've not heard of that. It's kind of like Tai Chi, but more focused on simple movements coordinated with the breath. So part of what's so interesting about Qigong is it's a mind-body meld of practice. And with that said, what that means is that it's part movement and part meditation. And there are from China, I don't know how many different styles but they're all pretty good. But the main thing that we're trying to expose to people with Qigong is to how to get the mind and body to work together. The mind heals the body heals the mind. And Dr. Deitrick, I really liked your presentation on the meditation part and also the gratitude. I agree with you more than you can imagine, because the gratitude is way more than what the science has been showing. Because it's not just, Qigong doesn't affect you personally, but it kind of gives you an aura of helping people around you as well. So your mind changes, your thought process changes. And so the gratitude, again, thank you, it really comes out that you start to see the bright side of things in life, and the light that you might not be able to find, but that's because you become part of that light. So it's a very hopeful kind of practice. It is something you would have to practice pretty much every day, but the movements do not have to be difficult. I don't know if I have enough time right now to show you a few moves or later, but it's
later. I'll bring you back.
Okay.
Yes, stay as long as you can stay. We'll definitely record you. Yes.
Okay, but it's very simple movements. They don't have to be complicated, even though some styles there are complicated moves, but they don't have to be. So,
okay. Thank you so much. Yes, I would love to see them. I'm really impressed with Jonathan, and movement is something that we really have to get with exercising, and really take an interest in it as well, because it can be a lot of fun and it can relax you. So over to you, Leri Smith.
Hello, everyone. My name is Leri Smith, and I am a metaphysical minister, an energy healer, and I am the owner of a business called Energy Awareness. With Energy Awareness, I work with people who've experienced trauma and PTSD, complex PTSD, stress, anxiety, and I help them rise above like their stories about their trauma, where I really believe that all of our suffering takes place in our stories that we keep telling over and over again. So I help people find that pause between their stories. I teach them how to pause their thoughts and really just feel the emotion that they're going through with no story, no words, and kind of like a meditation, sit with it until it dissipates, and then become more like a creator, where I help them figure out what they really want, like what they want more than that to create in their life. And then I teach them how to become that. And it's pretty fast, and it's pretty simple. I mean, it's not like you just do it once and you're completely healed, but it's a practice. It's almost like a meditation, energy healing, psychology, and personal growth practice that you kind of do every day to heal your trauma. I had childhood trauma since before I was born, and I suffered a lot. And I came up with this when I was experiencing a really difficult time in my life, and I started to see I was able to separate from my thoughts, and I got to see them, that it was just that all of my trauma was sitting in my thoughts, and I was able to like rise above them. And I was able to start releasing all of the different traumas and anxieties that I was experiencing. And so I work with people now to help them, especially people who are stuck, who have personality disorders, and they just can't move on with their life. I help them find that pause between their story and their thoughts, and to move beyond it.
Yeah. think that's amazing. We all need that help for sure. My next person is Heather Campbell.
Hi, this is so wonderful to be a part of this conversation. Thank you all so much. I'm Heather Campbell. I'm the CEO of Ready, Set, Recover. We help people get ready for and recover from surgery in a better way by looking at the human side of surgery. So much of what has been talked about already in terms of the pillars of health are what we actually have in our program. I've taken what we're talking about here, the gold standards of stress reduction, really, and pulled them together into an online platform so that when people are going through this experience, they can actually take control of things that they can take control of. So often patients think that everything is just happening to them, but really they're playing a part in this. If I can share my screen for just a second, I'd love to pull up our program. So can you all see daily actions here?
Yes. Oh,
Wonderful.
I love those graphics. Oh my goodness, what fun.
We've taken a lot of energy to create an incredible user experience. And again, these are all of the things that you guys have been talking about. Being your own advocate, worrying, nighttime necessities, how you are sleeping, surgery sayings, positive storytelling, rallying surgery supporters, creating community. It's both holistic and logistic. The reality also of what we're doing is that I'm doing this at a time when there are two big motivators, urgency and fear. We all talk about stress. We all know that the people actually on this call know how big stress can play a role in our lives and how challenging it can be. And it's hard to get people to recognize these are things you can do. But during surgery, that stress and urgency, that timing really helps motivate people to participate in this. We are currently working with people. You can go to our website and you can buy the program if you are a patient. You could buy it for a loved one. It is an amazing gift. But really, I want to be working with wellness people, with health professionals, with hospitals and surgery centers, because surgery really starts the minute you hear the words "you need surgeries." That's when surgery starts. And my hope is that in that moment, you hear two things after that. Number one, your surgeon says, "I'm really good. I got the medical side," which most surgeons are going to say. And the second thing I hope they say is, "You're really good too. You're important in this. You're going to do this program, Ready, Set, Recover." So that is what we are doing. Similar to many of you, I also do a lot of public speaking. I also do a lot of workshops in order to get this information out. And really, I'm just excited to work with other people who are focused on how can people take control and action to be happy and healthy. Thank you all so much.
That's wonderful. Thank you. Yes. So over to you, Dana. Dr. Dana and I had such a long conversation. We had so much fun connecting.
Hello. Thank you. Wow, I'm learning so much just from listening to everyone's background. I'm Dr. Dana Wang. I'm a psychiatrist. And I want to say that there is a gap in terms of our mental health care for people to access. Too often, people do identify they need mental health, they want mental health treatment, but either they can't find a provider that takes their insurance, or it is too expensive for them to access. So with that belief, I co-founded a mental health clinic in which we are in network, and we train our own staff to set a very high standard. So for the treatment that they receive, it is high quality in-network treatment. So we operate in the 5 states, currently in the northeast region, New York, that's where I'm at, and New Jersey, Connecticut, Massachusetts, and Florida because of the snowbirds. we're hoping that for anybody who needs mental health, they can access good treatment. So that's my sincere hope.
Yeah, and that's so needed too. So thank you for all that you're doing. So Steve, I'm so delighted that you're here. He brings academic to this group and laughter. So go ahead, Steve. Tell us about yourself and what you do.
Professionally, I'm a psychologist, and I've had many paths during my career. I'm currently retired from private practice, but I've been a university professor at Pepperdine for over 35 years, and I've taught at a variety of other universities. And I have two areas today that are really my passions that I continue to work with. One is called deliberate practice training, and I've been doing that for probably 30 years. And that's a way of looking at how we teach people performance-based activities, how you teach therapists, which is my specialty, to be therapists. And the model that's currently used with therapists is one where you throw a lot of training, a lot of experience at them without training. In other words, most therapists are not observed very much and getting direct feedback. They get a lot of experience. So my area in the deliberate practice training is an area of looking at how we observe therapists, give them feedback, and help them to grow. But the reason I'm here today is much more interesting to most people. I'm one of the foremost experts on therapeutic humor, particularly in psychotherapy, but in general. I've been in the therapeutic humor field for, again, 30, 40 years. I've been the past president of the Association for Applied and Therapeutic Humor. I've been interviewed many times, but that's the area of passion that's a little more unique. And most people hear the term laughter is the best medicine. Well, laughter is one medicine related to humor, but there are others that are equally potent that we don't give credit to, or that gets confused with laughter. And I'll just introduce this real quickly, and if there's time later, I can talk more about it. But when you experience humor, you experience a physical response, that's laughter, an emotional response, which I call mirth. In other words, you might not laugh, but you feel uplifted. You have a cognitive response, which I label wit, which is a shifting of perspective. And then finally, there can be an interpersonal response, which is social. It's a social lubricant, and I call that relational fusion. And the research supports very clearly that all four of those areas have fairly effective health benefits. And you can parallel the wit, for example, to cognitive therapy, where in cognitive therapy, you're helping people to change thoughts, to change distress, and wit with perspective is exactly what cognitive therapy does. So anyway, that's kind of who I am and what I do.
That's amazing. Yeah. And so, yeah, we can, if you stay, we can talk more about it. So Sonnee, we'd like to hear from you about Affinity Health.
Hi, it's Sonnee. It's just spelled very weird. But it's so great to be surrounded by such amazing people. Like y'all are all doing such wonderful things. That's so great. So I have a private practice. It's a group practice. I'm a licensed marriage and family therapist and a licensed professional counselor. I'm licensed in 5 states. And I have a group practice and we have several clinicians. So we work in 9 different states. And we do counseling, right? Everything is virtual. And my specialty is working with couples. So I do a lot of couple work, premarital, stress within relationships. And we know when you're stressed, you don't communicate effectively, and all of that. So, and then we have other clinicians that work specifically with like anxiety or life transitions. We've seen that a lot with transitioning into college. It has been very difficult over the past several years with COVID hitting and just them not getting that experience and transitioning, and then they have to be in person in college. So we work with a lot of college kids as well, just the stress and anxiety, that kind of thing. But our group is called Affinity Triangle Therapy, Coaching and Supervision, and we're in 9 states. And yeah, that's me.
Wow, that's incredible. All right, so this ends our first part of the series, Health and Wellness. This is our 5th year of doing this event, and it is every time we do it, it's different. And we're so grateful that we have Dr. Deitrick for all 5 years, and it's been just a wonderful journey knowing her and now welcoming each of you. So thank you and welcome. You're watching Discover Brightside, and each of you have been discovered on Brightside. Please subscribe.